Hello, my name is Nkechi, and I'm going to be your student nurse today. How may I address you today?
Marielle is fine.
Okay, so how are you doing today, Marielle?
I think I'm okay, but my doctor is telling me otherwise, so.
Oh, really? Okay. Before we begin this section, just going to let you know that whatever we say here today, it's going to remain between me and you, except there's an indication of threat to yourself or to yourself or to others, and that's when I will disclose it to my team members. Is that okay by you?
That's okay.
Okay. At the beginning of the section, you said your doctor told you otherwise, right? Do you want to elaborate on more on that, please?
Well, I went to see my doctor last week, and he told me that my blood pressure is pretty high.
Oh, really? Okay. Well, based on the health examination done today, your blood pressure actually was a little bit elevated. It was 147/90, which is pretty high. And if I may ask, how do you manage your blood pressure?
Well, I take my blood pressure medications, and I kind of stay away from my food high in sodium, and I eat low sodium food. I do DASH diets.
Oh, okay. Can you explain to me what you understand by DASH diet?
So DASH diet, I minimize my food consumption of sodium rich, probably less than 2,000.
Okay. So from what you just said, I think you pretty understand what DASH diet means. If I understand correctly, what you just said, that your doctor thinks you're putting your health at risk by not complying with the health recommendation given to you, correct?
Yes.
Okay, permit me to ask, when you talk, can we talk more about the recommendation and the health risks?
Yes, we can talk about it.
Okay, thank you for your permission. So which one of it would you want to explore more, the risk factors or the recommendation?
I guess we can start with health risk.
Okay, health risks, and I commend you for coming in today, and more also for wanting to start the discussion with the health risk factors. This is an indication that you're concerned about your health, correct?
Yes.
Okay.
So yeah, nurse, I'm really worried in a way because I don't want to die and leave my son and grandchildren. I love them so much, and I know I've been stressed and feeling lonely this past month due to my health, due to the death of my dog, who has been my companion since the death of my husband. I miss him so much, but I do take my medications well. I know at times I do skip some days, but I just don't have a huge time for cooking, and since then I'm all alone. I don't have time to cook.
Okay. So sorry about the death of your husband and the passing away recently of your dog. It must have been pretty hard dealing with all of this. In addition to this, I really do commend your honesty towards telling me you do skip at times your medication.
Yes, thank you. Yeah, it's okay.
Okay. Let's talk more about the recommendation benefits now that the doctor gave to you.
Okay, well, I know that if I cut down on food high in sodium and take my medications regularly, it will reduce or eliminate risk of having heart attack. But nurse, I'm trying to do my best, but I don't think there is anything more I can do.
So from what I hear you say, you acknowledge that you have been skipping your medications, not adhering to the recommended diet due to you being stressed and lonely, correct?
Yes, that's correct.
I also hear you concerned about the risks of having heart attack and don't want to die and leave your son and grandchildren, correct?
Yes.
And that you think you're doing all that you can do, correct?
Yes. Well, there's really nothing else I can do.
Okay. Once again, I commend you for your effort in handling all the happenings in your life. Now that we have talked about the risks and the benefits of taking your medication and diet and adhering to your diet, on a scale of 0 to 10, 0 being the least, and 10 being the highest level of readiness in taking initiatives to improve your health. At what level do you think you place your readiness?
Well, I would say I'll put myself at 4.
At 4?
Yes.
Okay. And if I may ask, why not 1, 2, or 3?
Well, I know that I have to make changes if I want to live and see my grandchildren grow up, and get married. So.
Okay. I do appreciate your interest for a change and commend you for that. Can we talk about how you plan to make these changes?
Yeah, sure. So I think I will start by stopping the dog shelter thing and see if I still fall in love with the dogs and put up some adoption, right? And I'll also tell my son to get me one of those weekly medication cases.
Okay.
Those ones where I can sort them out into like daily things, and also I can set up an alarm clock to remind me.
Oh, good. It sounds you've cut out plans and of taking care of this. And if I may ask, if we can have your son come in weekly and help you sort the medications, do you think you can increase your level of readiness from 4 to, let's say, 5 or a 6?
Well, that would be nice by doing so. I think I can get to see him more often and also do more of the cooking for both of us, and reduce my eating out. We go out a lot, so.
Okay, that sounds good. That sounds good. It seems we have a good plan in place, which are that you will stop by the dog shelter and have your son come in weekly to help with starting your medications, which will stimulate your cooking again, correct?
Yes.
Okay. Once again, I thank you for coming, and I also want you to understand that whatever decision you take today, it's concerning your health, it's solely your choice.
Yes.
And it's solely your choice, and I commend you again for your effort. And before you leave, I'm gonna hand you one of this Canada food guide that will help you follow up. That will help you in selection of the appropriate food for you. Okay? And I look forward to seeing you in 3 months' time.
Thank you.
Thank you for stopping by.
Thank you.
Have a good day.